I'm Councillor Koto, Cabinet Member for Health and Wellbeing at Southwark Council, and I'm proud to support Black Maternal Mental Health Week, coordinated by the Motherhood Group. The UK has one of the lowest maternal mortality ratios in the world. Glaring and persistent disparity exists in healthcare outcomes for women depending on their ethnicity, and it's vitally important that we work to change that. Maternal mortality for Black women is almost 4 times higher than for white women, and significant disparity exists for women of Asian and mixed ethnicity. In Southwark, we believe in equality of access to healthcare for our population, and Partnership Southwark's 1001 Days programme is engaging on a whole family approach to giving children the best start, with a focus on the first 1001 days of life, from pregnancy to age 2. The 1001 Days programme is designed to facilitate more intimate local conversations, bringing together local supports and expertise of residents from both public, private sector and community groups. We believe that everyone has an equal and valuable voice, so we are committed to making sure that our engagement is ongoing and representative of the borough's diversity. By 2027, our aim is that all women and their partners who live in Southwark will feel empowered to provide the best start in the first 1001 days of the children's lives, with family-centred support and services that meet their specific needs.
My name is Munira and I am a staff at Parent and Communities Together in Southwark. PACT is an umbrella organisation for different projects including Mum Space, Parent University, Black Maternal Voices, which are voluntary parent-led groups that provide activities to support families. PACT's main goal is to empower and support parents in order to improve their health and development outcomes of young children, the parents in Woolworth and Camberwell. I support the Motherhood Group's Black Maternal Mental Health Week UK. We value the importance of engagement. One of our missions at PACT is to work in partnership with service providers to increase engagement and participation in services. We want to help service providers understand and act on the need or issues that the community experiences. It is widely known that increased participation and empowerment is linked to improved outcomes for health services and communities. PACT is delighted to be part of this year's Black Maternal Mental Health Week UK.
Hi, my name is Gay Palmer and I'm a social prescriber. I support the Black Maternal Mental Health Week UK, which is being coordinated by the Motherhood Group. Social prescribing is focusing on what matters to a person and supporting them in their practical, emotional and social aspects of their health and well-being, and connecting them to local community services that can support in these areas. The power of social prescribing means that anyone within the communities and the communities of Southwark specifically is ensuring that your voices are being heard and valued, ensuring that we can make a difference. The power of social prescribing is about empowering a person to improve their health and mental well-being and building communities and bringing a stronger cohesion.
Hello, my name is Bola Olatunde. I am a Communications and Engagement Manager at Partnership Southwark. I support Black Maternal Mental Health Week UK, coordinated by the Motherhood Group. Community engagement helps to increase our visibility as a public organisation, and it gives us a better understanding of the challenges and strengths within Southwark's diverse communities. It also fosters better cultural competency and a better understanding of how to provide services for people in our communities. We know that effective engagement is built on guiding principles that support relationships and benefit both parties. So we're looking forward to working closely with the Motherhood Group to have a better understanding of the reasons behind the disparities in access to maternal services, and by so doing gain better insights into maternal and perinatal mental health of our population in Southwark. Since a high proportion of people from Black, Asian and minority ethnic communities are often least likely to engage, it is particularly important to involve community and faith leaders, social enterprise and charities with established connections to help us put in place holistic long-term strategies that address factors for poor maternal health outcomes. I would reiterate the importance of cultural competence as it promotes more patient participation and engagement, as well as respect and improved understanding. And this can only lead to increased patient safety, reduced inefficiencies, reduced care disparities, and in the long term, decreased costs.
Hello, my name is Margaret Taribo, and I'm the Executive Director for Parent Skills to Go CIC. Parent Skills to Go is an umbrella organization for various projects, including Little People's World, that provide holiday activities, we provide events, we provide workshops, training, and so many things that that support families. We consider these to be soft outreach projects because we value the importance of engagement to make sure that our families are supported appropriately. The holistic aim for us is to promote the physical, the mental, the emotional, the financial well-being of families. Because when we do this, we can actually make sure that they are signed or they can access the right services that can help them in the community, that can help their families, whether it's housing, it might be mental health, it might be, education, whatever is needed, and which is why we value the importance of collaboration. So one of our missions really is to work in partnership with other service providers, because an increase of participation and engagement is so crucial. It's important because when we understand or when we act on the needs and the issues that communities experience, we know we can improve or have a greater impact on our society. We've had the privilege, even in recent times, to work with organizations like Partnership SODOC and the 1001 Days Project. We actually did a piece of work with young people recently, and we used their creative expressions and their fun ideas during one of the half-term events to look at the neighborhood of Camberwell. What we did was we used the creative art and writing to talk about and use the surveys that residents fed into to know what the neighborhood entailed, what was important to them, what could improve. And these children came out with the result. They used the survey to develop a creative angle, drawings, pictures that showed and expressed how they really felt. Now, it is widely known that increased participation and empowerment is linked to improved outcomes for health services and communities. So, Parent Skills to Go is delighted to be a part of this year's Black Maternal Mental Health Week UK, coordinated by the Motherhood Group. I truly hope that this, as well as other collaborative processes, will help all service providers achieve better outcomes for more families and communities in Southern.